Yeah, so tell us, if you could change one healthcare policy or regulation, what would you change and why?
So I wouldn't change one. I would accelerate the enforcement of the information blocking rule. Absolutely.
Okay.
I think that's an awesome rule. I think it's very complementary to the great free markets. And I think if there was solid enforcement already in place, we would see a lot more data sharing and a lot more people getting the information they need on the patient side. So that's what I would do. I wouldn't change anything. I would just make it move faster and make it harder.
Yes, that's a great question. If I could change one healthcare policy or regulation, it would be how nurses are reimbursed. So currently, nurses are not a billable charge for hospitals and health systems. And I think that when we look at the staffing crisis that we have, it actually hurts our ability to be able to elevate the nursing profession and recognize it for the value that it brings to both patients as well as the hospitals and health systems that it serves. And so I would really like to see the legislators start to think about how CMS reimburses for nursing services, and I'd like to see it be a billable charge, just like it is for physicians, for physical therapists, for phlebotomists, so that we can use that to address the nursing crisis and staffing shortage that we have today.
Sure. I think as a health IT vendor, one of the most challenging things is our ability to be interoperable with workflow. So data interoperability is something that I think we have accomplished, and of course with the 21st Century Cures Act, there's a lot of, let's just say, incentives for covered entities to open up data in standards-based formats, and I only expect that to improve, but it still doesn't cover a lot of the workflow efficiencies that I was talking about earlier. So if you want to tackle some sort of workflow problem that spans or exceeds the four walls of the organization, and you want to use AI to do that, it's very difficult because there's no standards and there's no mandate or regulatory guidance for various workflows that obviously make an impact on healthcare today. So I would expand the 21st Century Cures Act to more workflow standardization and open that up to vendors to really move the needle on improving care, reducing costs, and increasing quality. Thanks.
Awesome. Thanks, Dave.
Yeah, no problem.